guys, this is Miss M and I'm here to discuss the first part of the last topic for Casld 1, which is cerebral palsy. So let's start. So what is cerebral palsy? So we have cerebral, which means brain-centered, palsy, which means lack of muscle control. So this is also called, or cerebral palsy is also called little disease or infantile paralysis. So this condition is a non-progressive neuromuscular disorder caused by damage to the immature higher brain centers. So this neuroprogressive abnormalities in the developing brain can create a cascade of neurological, motor, and postural deficits in a developing child. So let's move on to the etiology, or the causes or set of causes for this condition. So this is subdivided to different periods of pregnancy. So first we have prenatal period, or before giving birth stage. So here we have maternal factors that are not related to pregnancy. So this could be intellectual disability, hyperthyroidism, thyroid use, and or estrogen use. We also have histories of previous abnormal pregnancies and placental complications, which usually happens in the third trimester of the pregnancy stage and is characterized by bleeding, placental insufficiency, and risk factors include multiple pregnancies. Next, we have preeclampsia. So this is a toxic condition in the which develops in the late pregnancy stage and is characterized by sudden rise of the blood pressure levels, excessive weight gain, generalized edema, severe headache, and visual disturbances of the pregnant mother. We also have eclampsia, which has similar characterizations of the preeclampsia. However, during eclampsia, the mother experiences convulsions and possible coma. And then next, we have maternal infections, which can be which we have a mnemonics called torches. So let's go into them one by one. So for T, we have toxoplasmosis. O, other infections such as varicella. R for rubella. C for cytomegalovirus. H for herpes simplex. E for enterovirus, and S for syphilis. Okay, under prenatal period, we also have trauma and drug abuse of the pregnant mother, genetic predisposition such as microcephaly, prematurity, which is the most common antecedent for cerebral palsy. So this means that the baby is born at like less than 36 weeks of gestation. And last, we have incompetent cervix. So moving on to the perinatal period, or the period of giving the actual birth na jud. So first, we have perinatal intrapartum asphyxia. So this is due to the obstetric complications and is considered as the main etiological factor of cerebral palsy. Next, we have placenta previa. So this presents at the second trimester with painless vaginal bleeding. Third, we have abruption placentae. So this presents at the third trimester, which is characterized by separation of the placenta from its uterine implantation site. Then next, we have cord prolapse. So the cord here is displaced and becomes compressed between the fetal presenting part and the maternal bony pelvis. And next and last, we have nuchal cord for this slide. So this is when the cord wraps around the neck of the fetus inside the tummy or the womb. Next, under perinatal period still, so we have mid or high forceps delivery. Next is bilirubin encephalopathy. So this is an increased free serum of bilirubin factor and increased permeability of the blood-brain barrier. So this is marked by deposits of bile pigments in the nuclei of the brain and spinal cord. And we also have kernicterus, which was explained earlier, and prolonged and difficult labor of the mother. So moving on to the postnatal period, or the period of the actual giving of birth na. So here we have low birth weight of the child, so less than 2,500 grams. We have cerebrovascular accident, or CVA, encephalopathy, poisoning or any illness, and central nervous system infection. Under postnatal, we also have hypoxia, seizures, coagulopathies, neonatal hyperbilirubinemia, TBI or traumatic brain injury, and infections such as meningitis or encephalitis. So now let's move on to the prevalence or incidence of cerebral palsy. So here. So cerebral palsy is the most common and often extremely disabling childhood disability. It is also considered as the most common disorder that affects children and adults in the world. So out of 1,000 births na ay 2 to 5 cases daw of children with cerebral palsy, and there's a 400% increase in the probability of cerebral palsy in twins births than a single birth. And then lastly, we have increased incidence of CP with spastic diplegia type. And these types will be later discussed. So in 5,000 infants, 1,200 to 1,500 preschool children are diagnosed with cerebral palsy each year. So this is in the Philippine context. CP is also more common in males than females, especially when kernicterus is involved. So more patients with cerebral palsy than those with polio, spinal lesions, and other movement disorders. And this is also in the Philippine context. And we have here delays in cognitive development and below average intelligence have been seen in 50 to 75% of children with cerebral palsy, and seizures occur approximately 50% of the children with cerebral palsy. So this incidence appears higher among children with spastic disorders. So now let's go on to signs, symptoms, and pathomechanics of cerebral palsy. So for signs and symptoms, we have undertone abnormalities, we have decrease or increase or fluctuating resistance to passive movements. Hypotonicity is more prolonged in dyskinesia than spasticity, and hypertonicity is characterized by spastic or rigid types. So hypo meaning low tone, right? And then hyper meaning high tone, so rigid siya. So under tone abnormalities, still we have variable tones. So a patient with cerebral palsy may have increased resistance to passive motion, increased resistance and stiffness during pull to sit motion or hip extensor hypertonicity, and have spastic hip adductors. So they will have difficulties with separating their legs. Next sign and symptom for cerebral palsy is reflex abnormalities. So patients with spastic cerebral palsy may exhibit signs of unilateral motor neuron lesion, which is characterized by hyperflexia, clonus, enhanced stretch reflex activity, and these are frequent signs of cerebral palsy and adduction catch. Next, we have retention of primitive reflexes and autonomic reactions. So, diba, we have our reflexes when we were born. So, as we grow older or like as we develop more, those reflexes start to diminish. But here, by the name itself, retention, so wala siya nawagtang and it's still present until like nag-develop siya ang kid, and even beyond those ages na expected na mawala na to ang nakato na mga reflexes. So next, we have hyper-responsive tendon reflexes and involuntary movements. So this can be called as spasms also. Next, we have postural abnormalities. So this is the lack of muscle co-activation and the development of abnormal movement compensations. So next, we have lower extremity spasticity is confirmed. An extensor pattern is constantly elicited in lifting the child into a vertical position, and then it's influenced by primitive reflex activities as tone changes. So here, patients with cerebral palsy have postural difficulties, Jude. So you can expect na when you try to lift a child, kay kana yang lower X, Jude, so yung legs will have kanang atypical movements. So under postural abnormalities, still we have for spastic quadriplegia, we have Straffanger sign. So this happens when the shoulders are abducted, their elbow is flexed, and their hands are fisted. For hemiplegia, so there is an asymmetrical arm position. And for hypotonic cerebral palsy, they usually exhibit a frog-like position. So basically, it means that their arms are adducted, their forearms are pronated, and their hands are also fisted. So next, we have delayed motor movement. So here we have late attainment of motor milestones is a universal sign for patients with cerebral palsy. So dili nila ma-meet ang motor milestones expected for their age. We also have motor delays coupled with delays in other developmental areas. So not just motor, kay diba all our systems are like working together man jud, dili man siya separate system each. So other developmental areas are likewise affected. Next, we have atypical motor performance. So we have asymmetry in the use of extremities. So kanang depende sa type sa kay you have the hemiplegia, you have diplegia, quadriplegia. So depende sa affected areas niya, depende sa type. So for hemiplegia, there is an asymmetrical upper extremity use or apparent hand preference in the first year is one of the early signs. So there's also a history of abnormal crawling, stance, and gait. So this is already self-explanatory. Stance, the way the person stands, gait, the way the person walks. And then for hemiplegia, we can see that they usually propel using their unaffected arm or leg. So adto sila makuha og kusog. If they want to move, they use their unaffected side. And then for diplegia, meaning ang duha naman ang affected, so they combat crawl or bunny hop. Next, we have discrepancies in cognitive development. So basically, this is already self-explanatory. So naadjud as I've mentioned earlier, so not just ang motor systems ang naay problem, but also other aspects such as ang cognitive development sa child. Then, children with cerebral palsy may have problems with the visual system. So some may have impaired vision, naadjud uban na complete blindness, limitations in eye movement and eye tracking, squinting, strabismus, eye muscle weakness, and eye incoordination. So basically, from this pa lang, diba, this is a precursory skill. So kids with kanang cerebral palsy who have difficulty with kanang eye tracking ng gani or eye movement, kay kana will be one of the kanang indicators for delays or kanang disruptions of language learning. They may also present auditory disturbances. So under auditory disturbances, a child may have difficulties with one or more of the auditory scales. So some cerebral palsy patients will need hearing aids. Next, we have behavioral problems and psychosocial delay. So kana most of the children I had experience with na naay cerebral palsy, kay they really had behavioral issues jud, and then especially those na wala pa sa nag-OT. So it was very hard to manage. It was very challenging rather to manage the behavior, and then considering pa na they move a lot tapos limited pa jud ilahang movement, so kana you have to work with the parents. And then for pathomechanics, we have parasagittal cerebral brain injury. So here we have the subcortical white matter lesions surrounding the lateral shed zone. So most especially in the posterior, superior, and middle part of the brain. So here we have ang upper extremities jud ang mas ma-affected rather than lower extremities for spastic quadriplegia. Number 2, we have periventricular leukomalacia. So this is around the ventricle where the white matter is softening. So for here we have lower extremities still ang mas affected rather than upper X for spastic diplegia. Then for third, we have almost all patients with cerebral palsy show resistance to passive movements or hypertonia, so rigid, ing ana. Fourth, we have hypertonia did not necessarily impair voluntary flexion or extension movements. So especially if alternating EMG activity is maintained in at least one of the pairs of the flexor or extensor muscles involved in movement. Fifth, we have single motor units recorded from patients with dystonic movements were recruited with variable delays and usually discharged intermittently at high frequencies. And sixth, we have abnormal motor unit discharge patterns may relate to pathology of the basal ganglia. So moving on to the characteristics of speech language problems of patients with cerebral palsy. So first here we have speech. So under speech we have articulation, voice, and fluency. So patients with cerebral palsy may exhibit difficulties sa articulation. For example, they may have imprecise consonant production, incomplete phonetic repertoire, phonological awareness, and breath support. So considering also na ilang structures are affected, they might be hypotonic or hypertonic. So kana pa lang alone maka-affect sa ilang articulation. Next, we have voice also. So they may have difficulties with their intensity or loudness ranges, difficulty in also varying their loudness, also their frequency or their pitch. So lisod sila og change ilang pitch and have variations with it. And then they may also have breakdown sa quality of their phonation. So they may exhibit a harsh or hypernasal type of voice quality. So depende case-to-case basis sad. So we have to consider na since their structures are affected, most likely ang structures used for speech are affected, nya mo na maka-disrupt siya na siya breakdown sa domains of speech. And lastly, some patients with cerebral palsy may have fluency disorders or like stuttering behaviors, kanang mga prolongations, blocks, and then repetitions also. As for language, so diba, as I mentioned earlier, they may have cognitive problems. So, affected sa ang ilahang language learning, and then other precursory skills like atong eye movement pa lang, kay mo to mga baseline skills, diba, for language learning. So, if the kids have breakdown there, so we might as well expect na they have language difficulties. So, they may present difficulties in identifying and labeling vocabulary and concepts such as mga ADL objects, ingana kanang mga common people, common places, and then they might have difficulty with answering or with their auditory processing skills such as following commands, answering WH questions, also difficulty with higher language skills, so kanang mga ITS like integrative thinking skills, so problem solving, inferential reasoning, ingana. So for hearing, as mentioned earlier, they may have some type of hearing problems that might require them to wear hearing aids. So it's best na you have like an audiologist jud na ipa-check mo sila to have like an objective assessment based on their hearing. Depende sa case-to-case basis. So they may have breakdowns in some or all of the auditory skills. So katong detection, discrimination, identification, or comprehension. As for feeding, so they may present preparatory oral dysphagia or problems with kanang, for example, drooling, like spillage of food, like when they eat, kay dili ma-complete og kanang kuha ang tanan food sa spoon, ay mabilin, they may have oral dysphagia, so kana delayed ang swallowing timing sa ilahang pag-swallow sa food. They may have pharyngeal dysphagia, so they may have risk for aspiration due to poor functioning sa structure. So instead na mo-close ang epiglottis sa kanang trachea, kay dili na siya mabuhat, so ang food manaog na noon sa trachea going to the lungs, so aspiration. Then also esophageal dysphagia, so they may have difficulties with their kanang esophagus or like kanang esophageal dysmotility or kanang maglisod ang esophagus og push down the food to the stomach. And then that's it for the first part of the cerebral palsy discussion. Thank you guys. So if you have any questions, feel free to ask during your live processing with Miss Hannah Guilliera.
Hello everyone, good day. So I am Hannah and I will be your SLP Academe intern for Casld 1 until May. So I hope that everyone is doing well and I hope that everyone is ready to listen to the discussion for today. So now we will be discussing the second part of cerebral palsy as Miss M already discussed the first part. So without further ado, we can now start with our discussion. So first, let's talk about the lesson objectives first. So the first one is to discuss the specific physical and psychosocial conditions occurring in children that can interfere with the normal speech, language, hearing, or swallowing function. So this is in terms of types, course, prognosis. We also have management and existing support system in the country. So our second lesson objective is to describe the speech, language, and swallowing problems that may arise among those with cerebral palsy. We also will be discussing the third lesson objective, which is to communicate in oral and written form using the appropriate professional register and language form for classroom or clinical setting. So let's now start with the types of cerebral palsy. So do you guys have any idea of the different types of cerebral palsy? There's actually a lot, no? So we're going to discuss this in the succeeding slides. So now I want you guys to think and reflect what are some types of cerebral palsy. So you can just pause through the video so that you can think, and then once you are ready, you can just play it, no? So here. So now I'm going to show the different types of cerebral palsy. So here we go. So see, you can see that there are a lot, no? There's spastic, dyskinetic, and ataxia. So we're going to discuss all of these in the following slides. So let's start with the first type of cerebral palsy, which is the spastic or pyramidal cerebral palsy. So this is the most common type of cerebral palsy, and this involves tightness of the muscles of the body. So it also says pyramidal because this specific cerebral palsy also affects the pyramidal tracts. So here, when a person has spastic CP, they have tightness in the muscles in parts of the body. Thus, they are unable to move this or relax their muscles because sobrara siya ka-tight. So as you see here with the kid, she has difficulty walking, no, because there is stiffness or tightness sa iyahang extremities, no, sa iyang arms and sa iyahang legs. So here, a person also has difficulties with movement, coordination, balance, and also this also affects talking and eating, diba? Because once we talk and we eat, we move our different muscles man sa ato ang oral structures. So that's why speech and feeding is highly affected yun among those with CP. So now we have different types of spastic, no, cerebral palsy. So we have 4. So I want you guys to think again, no, what parts of the body ka ang affected based on these different types. So we have monoplegia, hemiplegia, diplegia, and quadriplegia. So you can just pause it again so that you guys can think. But this is quite obvious now because it's already in the name itself, no? So sige. So we're going to discuss this over here. So we have first monoplegia. No, so when we say spastic monoplegia, this affects one limb, usually an arm. No, it can also be that the leg is also affected, but one part lang. Thus the term monoplegia. And then next, we also have hemiplegia. So hemiplegia, affects one side of the body, no? So one side yun na siya, and then this would pertain to maybe one side of the leg, one side of the trunk, or one side of the arm. So kana. Dapat same side sad yun siya, no, as you see in the picture. And then we also have diplegia. Another term for this is also paraplegia. So this affects either the both arms or both legs. So it may affect all of your upper extremities, so both of your arms and or your upper body, and then your lower part or your lower extremities. And then we also have triplegia. So it's not presented here, but there's also another type which is triplegia. So it affects 3 parts of body, no? So this may affect both arms and one leg or vice versa. So you have both arms, one leg, or both legs and one arm. And then for the last one, we have quadriplegia. So quadriplegia affects all of the 4 limbs. So this is the whole body na yun, no? The trunk and the face is also included, especially the muscles that control the mouth, the tongue, and the windpipe are also affected because whole body naman siya. Thus, it would be difficult to eat good and talk. That is why they need good SLPs and other medical professionals as well, no, which we will discuss later on. So now we're going to discuss non-spastic because we're finished now with the spastic, no? So now we're going to discuss the non-spastic or the extrapyramidal cerebral palsy. So we have two main types, which is dyskinetic cerebral palsy and ataxic cerebral palsy. So for this dyskinetic CP, we have athetoid and dystonic. So there you see there are a lot, you know. So when you see a patient with CP, you really have to determine or identify unsa jud kaha ang iyahang type because there are a lot jud. Sige, so we're going to start with dyskinetic cerebral palsy. So there it's divided into two. This is athetoid and dystonic. So dyskinetic CP pertains to muscle tone that fluctuates between loose and tight. So kana inconsistent yun iyahang muscle tone, no? Okay, this may be hard or kanang gahi siya, manggahi sila, or medyo loose rasad or kanang flaccid. And then they also have rapid, jerky, and uncontrolled movements. So this occurs involuntarily. So dili gyud ni ma-control sa patient, and it affects the neck, the face, the hands, the feet, arms and legs, and also the torso. So kana different parts of the body are affected. So here, this is a video of dyskinetic cerebral palsy. So I want you guys to observe, no, how the person performs an activity. Okay, so here, the person is trying to write. Okay, so I want you to observe iyahang hand movements and how he holds the pen. Okay, there. So, diba, the person really has difficulties with moving or controlling iyahang movement once mag-write na siya. So, kana. This affected his hands, no, as you see in the video. Sige, so next, we're going to be discussing the next type of cerebral palsy, which is athetoid cerebral palsy. So here, this pertains to relaxed and limp muscles during sleep. They also have involuntary jerking, or what we call chorea. So I hope you guys understood the joke. So there, that's chorea, no? That's involuntary jerking, or mukalit lang og jerk ang isa ka part sa ilang body. So this is a subtype of dyskinetic CP gihapon. So if the face and the mouth muscles are affected, problems may develop that are related to unusual facial expressions, kaya di na nila makontrol nino. They also have drooling, difficulties with speaking and choking when they are drinking or eating. And then the body and the neck are held also in a stiff position. That's also one manifestation so those with athetoid CP. Okay, so here's a video again so that you guys can visualize athetoid CP. Okay, there I want you guys to look at how the kid or the child moves involuntarily. Dagan kay siya movements nga dili makontrol sa iyahang arms and sa iyahang legs. So iyahang whole body yun na siya. So that's one example. And I'll also be posting this video sa Google Drive and sa Cello so you guys can just check out, replay these videos also. Okay, so next we're going to discuss dystonic cerebral palsy. So this is involuntary, sustained, or intermittent muscle contractions. So this is also characterized by hypertonia or kanang mga involuntary movements na siya, no? So hyper meaning daghan ra kay og unnecessary movements. So kana involuntary postures, movements as well, no? As we see here. And there is also repetitive movements, abnormal posture, and the like. So kana. And then the next type of cerebral palsy is what we call ataxic cerebral palsy. No? So this is still under non-spastic na cerebral palsy. So this is one of the rarest types of rarest types of cerebral palsy, and it involves the entire body. So here they may have problems with precise movements. So when they try to get something, medyo they may reach too far or too close. So dili gyud siya enough no once mo do sila og movement. And then they may also have poor coordination, no, so they have poor hand control, they may have tremors, no, or shaking movements, and then they may also have difficulties with hand control and balance. So kana during walking, they may walk with the feet usually far apart, and for hand control, kay they may have difficulties in reaching for an object or shake hands, or kana there are kind of tremors, no, or shaking movements. So kana they may have difficulties performing activities of daily living such as buttoning their clothes or writing using scissors, no, kana mga fine motor movements which entail usage sa atong hand. So that's why an occupational therapist is also very important, no, in our medical team. So kana because they will help you with kanang fine motor ng mga activities also in our daily lives. All right, so this is another example of ataxic CP. So, sige, I'll play it now.
The last gait that I'm going to demonstrate is the ataxic gait. In the ataxic gait, the patient has difficulty narrowing the station and maintaining balance. So typically they'll have a wide stance, is trying to maintain balance.
So, they have difficulties with balance, coordination, no? As I mentioned.
And that there oftentimes will be unsteadiness in the trunk. So there may be some truncal titubation, which is an anterior-posterior type of tremor at about 3 hertz. And there's also a tendency to lunge or to jerk sideways, and the patient then has to catch themselves. Of course, one of the ways to bring out this particular type of problem is to narrow the station, asking the patient to walk tandem. So if I then am ataxic, I then try to walk tandem, then I'm going to have difficulty walking.
Okay. So there you go. That is another example no, of ataxic cerebral palsy, or how they are going to walk. Now. Okay, next, our next type of cerebral palsy is mixed cerebral palsy. No? So from the word itself, no, mixed, this means that there is more than one type of cerebral palsy. So an example would include spastic lower extremity. So this is spastic diplegia. And also facial muscle control. So they have difficulties with moving the muscles sa ilang face. So it is a combination na of 2 or more types pagid of CP, no, in kanang serious cases or much more severe cases. Okay, so next we're going to discuss total body cerebral palsy. So this affects the entire body. So from the word itself, na total body. So this may include any of the following. So kadto atong discussed a while ago. So this is spastic quadriplegia, quad because 4 parts. We also have dyskinetic CP and ataxic, no? Kadong video of the man walking. So all parts of the body are affected yun. Iyang arms and iyang legs. Now we're going to continue to the next part of the discussion, which is the course of CP or cerebral palsy. Okay, so here, the course of CP depends on the type, severity, and other associated problems. So those with mild motor involvement, they may continue to make motor gains and compensations, no, sa ilahang difficulties with movement. And then those in more severe forms, kay there is little progress that is made in attaining the developmental milestones, no, sa those pediatric population, and performing mga functional tasks of daily living. So as the child grows older, secondary problems will occur, which includes contractures, deformities, which will become more common, especially with those spastic. So another study also found that 75% of those with cerebral palsy has stopped walking by 25 daw due to fatigue and walking insufficiency. So this is by Murphy et al. So by 25 years old kay those with CP kay maglisod na gid sila og walk, no, and perform activities of daily living. Okay, so next we're going to discuss the prognosis of CP. So here, so first, this is divided into favorable and unfavorable. So we'll start with ADL independence or activities of daily living. No? So here we have ang favorable kay hemiplegia, ataxic, and diplegic. And those nga unfavorable includes quadriplegia, atonia, and rigidity. So kana no quadriplegia kay 4 parts na gyud siya sa body and rigidity. So if rigid jud kaayo kadto difficult biya jud mo control no sa ato ang movements kana tungod kay stiff kay siya or tight ra kaayo no dili maka-relax ato ang muscles. We also have the next part, which is upper extremity function. So for favorable, there is early preference for use of either hand, but not those less than 1 year old. There is also no hand ang unfavorable kay no hand preference by 3 years old. So if 3 years old na ang kid, kay dili pa gihapon siya makabalo if unsa ihang dominant hand, kay kana medyo red flag na siya no. And then for the speech, kay ang favorable utterance of recognizable sounds by 2 years old, and the child also speaks by two to three word sentences by 3 years old. And then the unfavorable, kay poor head control with hearing deficits. Na, no? Kay difficult kayo maglisod pag gani sila og control sa ilang head, how much more ang much fine parts no which includes ato ang speech and ato ang muscles of feeding and swallowing. So kana. Okay, next we're going to discuss gross motor function classification system for assessing the severity of CP. So there are 5 levels, you divide ni siya, and you guys can just read through it also, no? So 1 kay walks without restrictions, limitations in advanced gross skills. We also have walks without assistive walking device, limitations walking outdoors and in the community. The third type is, or the third level I mean, is walks with assistive device, limitations with walking outdoors and in the community. We also have the fourth level, which is self-mobility with limitations. So children are transported or use power mobility outdoors in the community. There is also the 5 and the last level, the 5th level, which is self-mobility is severely limited even with the use of assistive technology. So here we also have Molnar prognosis. So here there are different grades, no? So good, fair, and poor. So for good, able to sit at 2 years old without support. For fair, able to sit at 4 years old with or without support. And the poor, which is unable to sit at 7 years old. Okay, so now let's proceed to the management of cerebral palsy. So first, okay, we have the medical and surgical management, no? So this is anticonvulsant drugs. So this is commonly used among those with epilepsy or seizures. No? So these must be carefully monitored good, and this may affect the state of the child's digestion, their gums, and may require feeding adjustments as well. So you always have to be wary no, of mga medications kag takes atong patients because this can greatly affect ilahang performance during therapy. So that's why it's important to know all of these medical management as well and surgical management also. So here we also have anti-spasticity oral medications. So here it is explained that these show limited effect in intervening those with difficulties in muscle control among children with spastic cerebral palsy. It may also improve comfort in older children for shorter periods lang. So kana maybe dili gyud siya for a long term no, short term lang iyang effects. So next we have implanted medication pumps. So this is an example no, as you see there, naay injection. So this one is used to deliver anti-spasticity medication. So what was shown a while ago, no? So this one, that one. So anti-spasticity medications is placed in the spinal cord where it can directly inhibit motor nerve conduction. So it is also for lower and more controlled doses of medication and decreased spasticity. So this also helps good with those nga spastic nga cerebral palsy. Next, we have injectable botulinum toxin. So this is used to block the nerve muscle junction effectively. So that's an example. And then we also have orthopedic surgery. So as you see here, ang physician kay he is doing an operation or surgery sa knee of a person. So this is used to correct joint deformities, to balance uneven muscular contraction, and to reduce contractures that have resulted from abnormal and asymmetrical tone. That's also very important, no? And then we have the Luke procedure. So this is used in aggressive treatment of scoliosis, and it reduces tone and prevents contractures. So it helps in the stabilization or positioning, and also improves and increases functionality or functional activity. Next, we have tone reducing or inhibitive casts. So this strengthens and lengthens spastic muscles and also increases range of motion gradually. It also helps in the stabilization or position, and also often improves and increases functional muscle activity. Okay, next we have selective posterior rhizotomy or SPR. So this helps with those with spastic diplegia. So spastic diplegia. And then it helps improve motor control, gait, upper extremity function, sitting, and balance. So this also helps with those na diagnosed with spastic diplegia, nga naay normal cognitive status, no other deformities, and good underlying muscle strength. We also have the constraint-induced movement therapy. So this method uses restraint of the less involved arm and hand. So as you see, no, ang isa ka hand sa person kay gi-cover siya or gi-restrain, so that ma-promote ang usage sa kadtong stronger hand, stronger arm nga involved. So muna ang stronger hand ang mudu sa mga activities. So para mas ma-enhance siya. Next, we also have splinting. So this helps reduce tone or improve mobility and functional tasks. Next, we have the initial mobility devices or the aeroplane mobility device. So this provides developmentally appropriate positioning, particularly for children with spasticity. So, more of those with spastic CP gyud ang ato ang med-surg management. Okay, so now we will proceed to the critical members of the team. So let's start. So we're going to play a short game. So I'm just going to show you pictures of the rehab team or the team, the medical team, and then you guys have to guess this. This is very easy. I'm sure most of you are familiar and with these parts of the team. So you can just pause to the video and try to guess. Then you can count how many imuhang na get correctly. Sige, so let's start with the first one. Okay, this one, can you guys guess, no? If kinsa ni siya nga medical professional, this is very obvious also. Sige, so we can just pause. So this one is a pediatrician. So pediatrician is very important, no? Considering that cerebral palsy patients are those nga this is really developmental in nature. So once maborn ang patient kay na gyud sila CP or diagnosed na sila with CP. And it's very important nga included gyud ang pediatrician sa ato ang rehab team or atong medical team. Sorry. Okay, next. Oh, can you guess who this practitioner is? This medical practitioner. It's very obvious, no, with the one that she's holding. So there, that's the neurologist. So a neurologist treats brain disorders, including cerebral palsy. So as we all know, CP is a neurological condition, no? So neurological in nature. So that's why a neurologist is very important, because sila gyud ang mo give diagnosis and what we should do, no, with patients with cerebral palsy. So okay, next. Okay, this type of professional, can you guys guess? This type of professional. Okay, so that one is an occupational therapist. So there, OTs are in charge of helping patients no perform activities of daily living. So this includes kana mga fine motor skills, mga hand control, diba? Ilahang behavior sad if na sila behavioral difficulties, kay OTs also help with those. Okay, next. Okay, this is very obvious, no? So I'm sure you are familiar yun kaayo with this type with this professional sad. So this is a physical therapist. So a physical therapist helps those with CP who are experiencing difficulties regarding their mobility. So kana no those with CP kay kana movement disorders and gyud siya no aside nga neurological such in nature. So that's why a physical therapist is very important in to be included in the medical team also. Okay, next, our favorite. Okay, this one I'm pretty sure no you are very familiar with this. So this is of course no speech language pathologist. So some types of cerebral palsy are also associated with speech and language difficulties, as we discussed, no, and also as Miss M discussed, nga those with CP because they have difficulties with muscular movement or kanang movement sa ilang body, which also includes atong movements, atong structures. So that's atong oral structure. So that's why a speech language pathologist is very vital yun sa ato ang team. So, kana. Okay, next. This type of professional is a nurse. So the nurse is very important, no, because they would help in the medical medical aspects those with CP. So they will take care of patients with CP and will also assist no in their medications So next, okay, this one. So this is a clinical psychologist. So these specialists can help also with mood and learning disorders that some people with CP may also experience. So kana ato ang psychologist. Okay, next, this one very obvious no. So this is a pharmacologist. So a pharmacologist advises clinicians on the appropriate therapeutic drug monitoring. So kana we discussed naman the different medications, no, the medical management of those with CP. So kana it's also important to talk with a pharmacologist to see if appropriate ra ba ang dose kana because this really affects our patients and no in our therapy sessions. Next, we have our social worker. So social workers provide counseling for patients and their families and may also refer other community support. So kana. Next, this is a neurosurgeon. So kana a neurosurgeon is a physician who specializes in the diagnosis and surgical treatment of disorders of the central and peripheral nervous system. So kana no as I said earlier, CP is also neurological in nature. So that's why a neurosurgeon is also important yun sa rehab team aside sa ato ang neurologist. So, we also have the EEG technologist. So they are a trained medical professional who uses specialized equipment such as the EEG to locate brain abnormalities. So kanano dapat yun na-see ang mga brain waves and how the person or the child's brain functioning is. So that we could identify yun as ang main problem. So kana. Okay, next professional is an audiologist. So kana no, so CP patients may also be associated with other types of impairments. So this may include hearing impairment. So that's why an audiologist is also an important part of the team. So aside from hearing impairment, we also have those nga maybe na problems no sa ilang vision or na mga visual impairments. So that's why an ophthalmologist is also important sa rehab team. So or the medical team. So kana I hope that you guys got all of those, all of those medical professionals that is part of the team. So kana. Now let us proceed to the next part, which is the medical precautions regarding speech language therapy. So here, the first one is to have early intervention. So it's very important, guys, that you do therapy as early as possible. No, not just those with CP, but tanan yun, tanan conditions, mapa-pedia or mapa-adult. So kana early intervention yun to prevent further complications no regarding the child's speech and or language niyang functioning. So it's also important to train muscles of the oral peripheral mechanism. So you're going to provide exercises, mga massages in the mouth, in the jaw, sa throat to enhance speech and functionality, no? Kaya na tungod sa sobra ka rigid ba or sobra ka tight sa ilahang muscles din sa my throat, so you can provide mga relaxation techniques, no, or mga massages so that mas mo alleviate ilang pain and mas mo increase ilahang speech intelligibility or mas maka-understand ka sa ilahang speech. Next also is, of course, to examine the case history of the patient. So kana you always ask for the medical history or ask the parents and the guardians about the child's overall physical and cognitive functioning. And then this also includes examining some oral cavity, doing articulation assessments and other SLP assessments, no, so that we could also come up with the best intervention plan for our patients. Okay, so when a patient also has a seizure, it's also very important that you do the medical precautions though with this one. So if the kid has a seizure, you must clear objects that may hit his or her head. So keep sharp objects away, loosen the clothing, and all of those precautions that I'm sure you're also aware and familiar of na. And that's also another. Okay, next, so we will be discussing the last part na sa discussion or sa report. So this is the existing support systems in the Philippines. So here we have the Philippine Cerebral Palsy Incorporated, or the PCPI. So this was found in 1956. So this is a non-stock and non-profit foundation dedicated to the treatment and alleviation of CP and other related motor disorders in the Philippines. So they also envision a better future for those with CP by advocating and championing for their rights as differently abled, productive members of the community and society. It is also the authority and leading institution for providing superior multidisciplinary care and management of individuals with CP as well. And the second organization or support system is the Cerebral Palsy Association of the Philippines, or the CPAP. So this was found last 1993. So this was formed by Rodrigo Capunan, a person who also has cerebral palsy, no? So he had spastic cerebral palsy, spastic quadriplegia. So kana. CPAP is also actively involved in the formulation and implementation of policies and programs for persons with disabilities. So today, the association has 200 members. So kana. Okay, so next we have speech, language, hearing, and swallowing problems that may arise in those with CP. So here we have articulation problems, no? So this is very common because, as I mentioned earlier, nga difficulties gyud sa ilahang muscle movement, muscle coordination, sa ilahang oral structures, which include the throat, ilahang tongue, ilang jaw, and lips. So kana it's very important that we also treat these, no, and assess these as well. And then we also have language difficulties. So aside from speech, we kids with CP may also have receptive or expressive language difficulties. So kana, that's where we come in, no, for language intervention. And then lastly is for feeding. So kana, no, feeding and speech somehow come together good because the structures that we use for feeding kay similar sa gyud sa speech. So that is why if na difficulties with speech, there is also a chance, no, the person or the child may have difficulties with feeding side. So kana, and I guess that is it. I guess that ends my report. Thank you so much, guys, for listening. And I hope that you guys learned something, no, with my discussion today. Thank you so much. And I hope that you all stay safe as well. And if you have any questions, you may just write them down so that we can discuss them later on in during the integration. And you may also email me, no, so it's all right as well. And I guess that's it. I hope you guys have a great day. Thank you so much.